me a high five.
Like many children, Jacob Crawford was not happy about getting a flu shot, but after having some high-tech robotic help during a recent study, the 5-year-old is now a little less apprehensive.
The robot comes from a company in France named Alberta Robotics, and it has never been used for healthcare applications before. And so this is the first study in the world that introduced a robot for people to interact with while undergoing a painful medical procedure. No other type of study of this kind has been done before, and so we were curious to see if perhaps it can help distract children during painful medical procedures, that it could just make the experience more pleasant for the children and for the parents, of course, who are accompanying their children for these procedures.
So when he came, it was great. He was clearly mesmerized by MEDi. He was really curious about MEDi. MEDi did a whole thing about relaxation with him and deep breathing and blowing on the duck, and MEDi was a distraction. And so all of those things combined, Jacob barely noticed the vaccination, right?
La.
Okay? And so that made it much easier for him, which in turn made it much easier for me.
So what we found was that children experience significantly less distress as a result of interacting with a robot while the nurse was administering the vaccination in comparison to those children who didn't have that kind of interaction. So what MEDi, the robot, was able to do is just take the edge off of the severe fear that some children had about the needle. Some children told their parents when they went home that they wanted the MEDi, the robot, for every one of their flu vaccinations. So we're planning a series of studies where we want to look at the effectiveness of MEDi interacting with children during blood draws and during IV starts, and to see if we can be just as effective there as we have been with flu vaccinations.
Though he's a little bit nervous today, he can tell you really described quite well the interaction with the robot that day. Sure. And the focus isn't the needle, the focus is the robot.